Hi everyone, my name is Mahoney. I am a physician associate here at Mid-State Skin Institute, and today I'm going to do an instructional video on the Fluorouracil cream, which is the compounded version of a chemotherapy cream that we often prescribe to treat little precancerous lesions called actinic keratoses, or sometimes even superficial skin cancer. You might expect the cream to come in something like this, either a tube or even a pump. And here is my patient who I'm going to demonstrate applying the cream on, okay? So first step, whenever you receive your prescription in the mail, you're going to want to make sure to wash your hands. Next step, when available, I would recommend applying some gloves prior to the application of the cream. So I'm going to do just that. As you can see here, actinic keratoses tend to be kind of pink and rough and scaly in nature. There's a spot here. He also has some spots here. If we move up to the forehead, you can see some roughness in his eyebrow and even a little bit on the forehead here. So I'm going to go ahead and apply a thin layer of the cream all across his forehead, temple, cheek, and jaw, just like this. I'm going to kind of distribute this kind of all across the face here. And then I'm just going to rub it in like a cream or a lotion. And you want to be cognizant not to get too close to the eye. So you want to stay on this side of the eye bone. After your twice a day application, maybe around days 4 to 5, you should start to notice a red sunburn-like reaction. So if your skin starts to turn splotchy, red, irritated, maybe even a little swollen or scabby, that's actually a good thing. That's how we know that the cream is working. Another way in which you can apply the cream would be to take a small amount, just enough, the area you want to cover. So in this case, I'm going to go ahead, take a small amount, and this will be enough for the back of the hand and arm. So I'm going to go ahead, just kind of distribute it out like I did on the face. Just going to rub it in like you would a cream or a lotion. Go ahead, I'll apply on this side. Once you're done applying the cream, it's very important to remove your gloves, or if you don't have gloves available and you used your bare hand, please make sure to wash your hands very, very well with soap and water, because we don't want the cream to start affecting any healthy skin. We don't want you to accidentally touch your eyeball or use the restroom and touch sensitive areas after application. Mr. John, what questions do you have for me?
When I'm doing this myself, should I do it after I work out in the morning and take a shower?
That's a great question. So the cream is instructed to be applied twice a day. So if you plan on being outside, getting hot or sweaty, or showering in the morning, you would want to do your first application of the cream after all of that. So for example, Mr. John here would do his morning workout, shower, dry off, and then do his first application of the cream.
When I'm out in the sun, should I protect my arms and my face from the sun?
Another excellent point. This cream is a sun-sensitive medication. So it's very important that you do your best to avoid the sun as much as possible. So what that means is if you are going to be outside, please try to wear a long sleeve shirt, sunscreen, which is safe to go on top of the cream, and a wide brimmed hat, as well as sunglasses. Not only can you apply sunscreen right on top of the cream, but if you're a woman and you want to wear makeup, you are also allowed to wear makeup on top of the cream. You also can wash your face like normal. You do everything like normal. Just make sure you apply and rub in the cream first. Especially, we do recommend, around days 4 or 5, when you start to get red and irritated, not only is sunscreen very important, but any kind of moisturizing cream, even something like a Vaseline or Aquaphor, or even a little hydrocortisone cream is definitely okay to use.
And how long Should I expect the peeling and the sunburn-like appearance?
Yeah.
All of that last.
Great question. So everybody's different, but I always tell my patients, expect to look like you had a bad sunburn for about a week or so. So the redness and the peeling should last about a week.
Should I expect that I'll have to have this treatment after this?
An additional treatment in the future?
Yes.
Yeah. You might be expected to do a treatment maybe once a year, maybe once every other year. But some patients, depending on the amount of sun damage, have to do this treatment maybe even 3 or 4 times a year. So it just depends on your sun damage level.
Also, is it okay to put the cream on right before I go to bed?
Another excellent question. So any sort of cream or lotion can take 20 to 30 minutes to sort of absorb into the skin. So I would tell my patients, try to apply it about an hour before bedtime so that it doesn't smear on the sheets or, potentially get on the pillowcase into your eye.
Also, in general, what age should you start thinking about getting this kind of treatment?
That's another great question. So we recommend everybody start getting a skin check around the age of 30. Now, of course, there are caveats to that. If you have a very strong family history of melanoma, you use tanning beds on a regular basis, you might want to consider, or you have a ton of moles, you might want to consider getting skin checks starting at an earlier age. But we recommend people get skin checks on average starting around age 30. We have some patients in their 30s who are prescribed this, and then some patients who use it when they get a little bit older, around 60 or 70. So it's variable.
Thank you for answering all my questions. I feel much better informed now.